Let me start by telling you the basic issue. You see, until we address the basic issue, all these symptoms of the problem of health care, the basic issue is health care cannot be a business. In my view, should not be a business. And you know, internationally, countries where health is run as a business have poorer health services than countries where health is run as a service. You may not believe it, but for example, Cuba has better health indices than the United States. Because as much as they have a lot of money, health is being run as a business. Now, you get into a problem where somebody is detained. It is illegal. But we see it from the point of view of the hospital. We don't see it from the point of view of the manufacturers of drugs, the manufacturers of oxygen, the manufacturers of IV fluids that the patient is given. So what we should address, can we have a healthcare system where people can actually access? In my mind, if you can really get to UHC where people can afford, then the question of detention will not occur. But now we are addressing the question of detention. It is illegal. Sure, it is illegal. But we not say, why is it that people are being detained? They are being detained because they cannot pay. So that is what we should address. And as you are saying, actually it is a lot more because health is coming more and more expensive. I have the experience of seeing this country where you had free health care on the NHS British system, where there was enough funding to the hospitals, so you walked in and you walked out. And I know some of you here will not believe that there was a time that government hospitals were better than private hospitals, that when you were transferring patients from Aga Khan to Kenyatta, because Kenyatta was a better hospital, by 1979, the delivery services in Kenyatta was better than in Nairobi. So, and people are not being detained. It is the cost of care.
Some of my audience members can't imagine that.
They can't imagine that. Well, I know they can't imagine that, but I know because I admitted ministers in Kenyatta. I clerked them as a young doctor under training. I clerked ministers to be admitted in Kenyatta. Now, if a minister is admitted in Kenyatta, the worry, hey, that minister is really doing badly economically. Whereas it is the public services that should be the gold standard. How can the private services be the gold standard and yet the majority of Kenyans cannot access them? The gold standard should the people. Okay. So in my view, I think we should look at this issue of UHC. UHC, from time immemorial, people have tried to get health cover that they can afford. But the actual word UHC is actually new. It comes from around 2004. And I remember I was at WHO when the issue came of how do people get health care. There were countries like ours that were saying, let's have a social health insurance where actually health is paid for through insurance, like in Germany, for example, that you have that. And there are countries that were saying, let's have it like the British system where the government has enough money. So what was agreed, every country will use their system that makes sure their people get the cover. And in my mind, we must go the insurance way. Work out all these health system issues, then work out how we pay for them. I'm actually an advocate of having a social health insurance where everybody pays. People will say, oh, if you put a lot of money in NHIF, it will be stolen. I have a very simple response to that. If you have a thief in the village, you don't stop rearing chicken, you just catch the thief. But you can't say we can't have social health insurance and put it mandatory. A lot of money in NHIF, it will be so. No, let's just stop the theft in NHIF. Let's have this social health insurance. Let people walk into hospital and walk out without having to put money in their pocket. Let a sick person who goes to hospital at night not be asked to pay so much money to be admitted. When we get there, the question of being detained will not be there. It may look
Yes, Doc.
like I'm being utopian, but we can get there.